Real Housewives of Orange County star Emily Simpson undergoes a hip replacement, and now we have more details than ever that we're going to share right now. Hey everyone, welcome to Thoracic Park, where we go over athlete injuries, celebrity surgeries, and how to get you back to being active and pain-free. Real Housewives of Orange County star Emily Simpson underwent a hip replacement back on October 28th. Following this, she shared details on her social media account of the whole process, detailing everything that she went through. And now we know more than ever, and we're ready to tell you about it. First, she talks about the pain, saying, quote, "Pain is way worse than I anticipated." Well, duh, you just had your hip cut into, your muscles divided, some of the tendons removed, the cartilage sawed off, and a metal implant hammered in place. It's gonna hurt. This is a big surgery that anyone that undergoes will tell you is painful, and will cause a lot of soreness following surgery. You can check my other video on hip replacements if you want a couple more details on the process and what to expect. I'll link it up right now. She shared a picture of her scar too, which in fact looks a little bit smaller here than it did on the actual show when we saw it there. And the size of the scar is probably somewhat relevant and related to the size of and amount of soft tissue that needs to be dissected. So the size of the scar doesn't really tell us a whole lot, except for the fact that she had an anterior hip replacement. Now, again, there's a lot of controversy about anterior hip replacements versus posterior hip replacements, and the literature has suggested that there is no significant difference long-term whether you get an anterior hip replacement or a posterior hip replacement. So if you're considering one or the other, you should talk to your surgeon about what's their preferred method, because really there's no difference. Emily even went as far as sharing an X-ray of her hip. It looks like it's a Depuy Actis non-cemented hip. For the non-medical people out there, it just tells us the quality of her hip. When it's non-cemented, she probably wasn't suffering from any osteopenia. She also shared a picture of her walker, which tells us that she's being smart after surgery. You know, you want to use a walker to offload your hip and give you some strength as you recover. Post-operatively, you might feel a little unstable as you're building up your strength. You might also feel unstable from some of the meds you're given. She's 43, which is relatively young for a hip replacement, and we don't know the exact reason why she had a hip replacement, but there are several reasons that can include hip dysplasia, trauma, or she could have had osteoarthritis or some other process that resulted in her having wear and tear on her hip joint. But regardless, she wore out the cartilage in her hip that caused major pain with any movement. She talks about how she gained weight, became depressed, had body image issues, and so forth, which is all expected in a situation where somebody has a level of activity that becomes hindered by something like hip arthritis that can be really debilitating in your daily functions. And this is why getting a hip replacement is so important and is such a successful procedure in relieving pain and restoring function. One other thing, she drank Enssure's carbohydrate pre-surgery drink, which I can't really recommend. You really should be NPO for 8 to 12 hours before surgery, which means you should have nothing to eat or drink leading up to surgery, and that's really for anesthesia reasons. There are a few exceptions to that rule, especially if you're taking blood pressure medications or you're a diabetic. And so these are things you need to clarify with both your primary care doctor as well as your surgeon leading up to surgery. Overall though, she looks great. She's been able to eliminate her pain and get back to being active and work on losing a lot of the weight that she had gained. So we're glad to see that she's doing great. That's all for me today, folks. Hope you enjoyed it. We'll see you next time here at Thoracic Park.